Hello and good afternoon, everyone. Welcome to the BMCC webinar, The Evolution of Digital Healthcare in Current Times and Its Potential. I am Jennifer, the CEO of the British Malaysian Chamber of Commerce, and it's good to be back. And today I'll be your host as well as moderating the panel discussion. So hope everyone is keeping safe and managing well despite the current lockdown, which we hope that to see the light of the end of the tunnel soon. So however, we must acknowledge that the pandemic has definitely, there are some positives behind all those gray areas and the negative news. However, the pandemic has definitely accelerated digitalization in every sector. And today we are pleased to have three distinguished speakers from the healthcare sector to discuss the impact of the pandemic to the healthcare sector itself. So with me today are three doctors in the house. We are so honored, two medical doctors and one doctor of philosophy. Our speakers for today are Dr. Sanjeev Panchal, the country president of AstraZeneca Malaysia, Professor Dr. Wong Piau, president of Digital Health Malaysia, Dr. Raymond, Choy, co-founder and CEO of Doc2Us. Firstly, to the speakers, I must convey on behalf of the Chamber and everyone out there our deepest appreciation to all healthcare professionals, including those in the ecosystem who has committed your time and dedication during this crisis. So thank you so much. And thank you today for taking time off your busy schedules to join us this afternoon to share your own insights and discuss how the pandemic has accelerated digital healthcare. So before we start the session, a little bit of housekeeping. Please submit your questions in the public chat, the Q&A function. Please do not share in the chat function that you'll see on your screen. So it's the Q&A chat feature on your screens. We will attempt to address your questions if time permits. So without further ado, ladies and gentlemen, may I now introduce to you our first speaker of the session, Professor Dr. Wong Piau, the President of Digital Health Malaysia. But before I pass the floor to Dr. Wong, may I just take a few minutes to share about him? I mean, I can't read all his profile. It's really very, very highly commendable, but just a quick background. Dr. Wong is a pediatrician and a child neurologist. He graduated from University of Malaya, but has worked and received postgraduate trainings in pediatrics and pediatric neurology in United Kingdom. Dr. Wong is a keen teacher and passionate about research, especially in digital health. He, as I said, his CV and profile is really distinguished. So I just wanted to quickly share a few things. He revamped the pediatric training teaching program in Northern England in the 90s. He's a founding member of Monash University, Malaysia. He has established community-based practice programs. Dr. Wong has also established the telemedicine research cluster in Monash University, Malaysia. And further to that, he was a founding member of Digital Health Malaysia, which the organization he's representing today. And Digital Health Malaysia is an industry-led organization to develop digital healthcare and an open ecosystem for various stakeholders. So I hope I've done you justice, Dr. Wong, in sharing a bit of your profile, but I think you have an amazing profile, same as the other speaker. So without further ado, I would like to pass the floor to Dr. Wong. Dr. Wong, over to you.
Thank you, Jennifer. Can you hear me?
Yes, loud and clear.
Okay. Right. Okay. Thank you, Jennifer, for the kind words. I think that's more than enough and more than what I deserve. And I'm just going to share my screen now. All right. Right. Okay. Can you see the screen here?
Yes.
Okay. Good. Okay. So now, so Thank you so much for the invitation for me to speak in this. I hope I can do some justice to it. And so I think I'm given the task of talking about evolution of digital healthcare landscape in Malaysia in particular, and a little bit digital health in general. I think it's a long one, so I have summarized it to about 15 minutes or so, but there's so much to talk about that I'm quite happy that we can actually engage subsequently if you have any questions after these sessions. I thought that I will actually introduce you all to Digital Health Malaysia, an organization that I co-founded with a few of my very close colleagues, which we started. And so Digital Health Malaysia was formerly known as Telemedicine Development Group. And we actually seized the need to change the health ecosystem, right? So, and the journey started way back about 7 years ago. And that was an email that I sent to the Director General, which is Director General now, actually, who is also passionate about digital health. All I said was that, hey, we need to look at it because we are not moving anywhere. Then I didn't expect him to reply, but he did. And so his reply led to the first meeting between Monash University Malaysia and Ministry of Health. And that meeting was very fruitful, obviously, because it led to the starting of an annual telemedicine conference, which we had from 2015. Bar for the few disruption like the election year and also last year, the pandemic, we had annually actually been organizing this telemedicine conference. We also have been organizing the annual telemedicine innovation challenge, where we try to actually unearth some important and some useful idea and help those who are successful on transition into commercialization. So that is an annual telemedicine innovation challenge. But during the first meeting itself, the Director General of Health, Tan Sri Dr. Nur Hisham, says that we need a guide, some form of group to actually provide advice and guidance. And that's how, on his advice, we actually set up the Telemedicine Development Group, which is a steering committee jointly chaired by the Director General of Health and also the chairman of MCMC, which I'm sure all of you know, that's Malaysian Communication and Multimedia Corporation. So we actually have a few meetings and we set up a few blueprint, a few direction to the ministry. And as we move along, then we begin to realize that I think the scope for telemedicine development group is too wide, because on one hand you have a policy which actually require the policymaker to delve in, and on the other end you have the commercial sector. So after much discussion, we decided to split into two sections where the Ministry of Health will continue to spearhead the policy making, which is the what I call regulation, etc., while we, the original group of us, go on and form the Digital Health Malaysia. And that was actually formed last year. And unfortunately, the pandemic delayed it by almost a year, but we have been quite active during that time, working in the background. And some of you may have attended the webinar that we have organized a series of it during the pandemic. And we also have been very active in advising the ministry on the framework going forward for digital health in Malaysia. And that framework, we have agreed, sort of more or less finished that project with one of the consulting firm, and that actually has been submitted to Ministry of Health. So that in a very simple form actually summarize what the journey that the Digital Health Malaysia has undertaken in the 7 years. And one of the things that we actually notice actually is the need to adopt an open ecosystem, open inclusive ecosystem, which we call a triple helix model of innovation. I will talk more about this in a while, so I think I'll leave this one just now for it. And in the Digital Health Malaysia, we have 4 trusts looking at 4 areas of interest at the moment. And in due time, we expect more to be actually included. But at least at this moment now, we have 4 areas where we think that we can be very useful. One actually is to provide some guidance about policy and regulation, which is a new thing. And I think we are not in the stage where it will be going to sandbox and to be implemented next year. And very soon you'll be gazetted into law. And so we can advise the what I call the stakeholder if you're interested in that. The second one, actually, which we are very passionate, actually, is knowledge dissemination and networking, human capital. And that's the one that we are using the annual telemedicine conference as a get together. And so we are now planning to relaunch again the telemedicine conference, hopefully by end of this year, if not early next year. And we also have started to look at the series of webinar, but looking at different emphasis, and then subsequently, hopefully we will start the digital academy. And research and development is the one that we hope to jointly work together with Ministry of Health in the NIH. And because Ministry of Health, obviously, as you all know, a rich vein of hospital that's actually good for our research. And finally, I think is the commercialization. So these are the 4 areas that we decided to actually concentrate. Okay, so that's Digital Health Malaysia in a nutshell. So coming back to the reality. So I'm going to use 5 personas to actually typify our current healthcare. The first is our gentleman, I call him Piau, who is actually a fellow settler, actually in Tanah Merah in Kelantan. So he has retired, but he has hypertension and he has actually diabetes. And he goes to his local clinic kesehatan, local clinic for periodic blood test and then what I call checkup. But he has to travel to Kubangkran for his follow-up with a specialist and occasionally to actually Kota Baru General Hospital or USM. So for him then, the issue that he always faced is actually that he has to see multiple healthcare providers. His records is all over the place and sometimes not confidential. And he cannot access the help and advice when he wants it. And obviously, because of the travel, he actually incurred quite a lot of cost. And now that he's retired, he depends on his children to bring him. So there's indirect and direct economic cost. So the issue he faced actually is that of this issue. Now, second persona is Cindy, who is now expecting her second child. And Cindy hails from Malacca but works in Kuala Lumpur. Because of the cost of healthcare in Kuala Lumpur, he actually will be delivering and allow her mother to actually take care of this second child as well, because to him is the affordability of healthcare in Kuala Lumpur. Next is Mazia. Mazia comes from Kuantan, and Mazia is a bubbling teenager who has unfortunately difficult epilepsy. And he follows up Kuala Lumpur, the Neurology Institute, and Kuantan for his other care. But because of the poor communication, her healthcare actually is not always aligned and coordinated. That's first thing. Second thing, typical of teenager, she always actually get very upset that he cannot be just another lad. And so to her, right, I think the communication should be done better, and that should be innovation to help her manage her epilepsy better. Laurie was a sort of expiring athlete before she met with unfortunate accidents and which rendered her paraplegic, but she still remained active. However, because she comes from Port Dickson, she has to travel actually almost weekly for her rehab in Hospital Cheras. So the issue that she faced actually is healthcare accessibility. Right, and then Just One is healthy at this point in time. All right. However, the pandemic has made his life miserable because he actually works in the hospitality section, and as we know that hospitality has ground to a halt during pandemic. So because of that healthcare event, now he is actually under a lot of financial pressure, and if this is not tackled properly and timely, that may just translate into healthcare issue. So if you look carefully and see on these 5 cases, it illustrates the issue that we're now seeing in healthcare, which is affordability, availability, and accessibility. Right, and we can see that this actually is the slide illustrate how healthcare has actually skyrocketed in the last 50 years or so. And in the developed country, the as a percentage of GDP has gone up to 16%. In the Asia Pacific, it's not too bad. It ranges for those with the exception of the developed country, ranges about 4 to 6%. However, if you look and see, and Malaysia is there, you can see that the healthcare has doubled in the 7 years that we actually from 2013 to 2020. So it has doubled in percent proportion of absolute value. So I think that healthcare is spiraling out of control, right? And the pain points that we always face, I think, in this is that one, actually, patient has no control. I think I'm sure that a lot of you actually have noticed that quite a lot of the time we actually depend on the healthcare provider. That means to say when they say what to do, we have to follow, despite the fact that we think that we can do better. So there's no control. That's one thing. And the healthcare structure, as you all probably know, that I think in the private sector, in the public sector, and within these two sectors, there's no alignment, and that the incentive is totally different, and that makes quite difficult and quite often doesn't respond to the patient's need. And I have already illustrated the issue of affordability, availability, and accessibility. But the fourth point is the one that perhaps relevant to the audience. I think that the small and medium scale enterprise, I think there are a lot of interest in migrating or in dabbling into healthcare and migrate into a knowledge economy. But unfortunately, I think that in Malaysia especially, is that the various stakeholders in healthcare tend to work in silos. And now, for example, the small and medium scale enterprise had the technological know-how, but they do not have the insight of a provider. And the provider, on the other hand, has the insight, but do not have the technology know-how and the research expertise. And the last one, the researcher and the academicians has the research expertise, but do not have either the technology know-how or the insight, and they don't work together. And that's the reason why we decided that I think we should actually try to promote Digital Health Malaysia, try to promote an inclusive open ecosystem. And I will illustrate that one of the concepts that we are working on at the moment, right? And I think the healthcare digitalization blueprint, I hope that it will actually come to play in place, hopefully after the regulatory framework, because that's the one that we've been working very hard together with the Ministry of Health to come up with some blueprint. Right. A lot of problems that I have mentioned, actually, a lot comes from our current healthcare ecosystem. Unfortunately, I'm one of them. I think the current healthcare system is very disease-based. And I think most of you, unfortunately, also is together with me, where we do not see a doctor until we are sick. We stay away from the doctor, a healthcare provider. But when we are sick at time, we have to travel to the hospital, to the clinic, etc., to see a doctor, and that actually takes a lot of time. And by the time, I think the cost is incurred to actually cure the disease. The pharmaceutical industry are actually also geared towards actually curing the disease. And most importantly, the paymaster also actually practices such approach, that if you know that the medical insurance that we have now do not pay out until you are sick and admitted to hospital. So, and this is clearly a very flawed system that we can see in NHS in UK, where I worked for about 10 years, where actually they are now actually struggling and potentially collapsing under the weight of the disease burden. Because with technology, I think the what I call treatment options are a lot, but come with the increase in option is a cost. And this is not helped by people living longer and unfortunately unhealthier, and also the explosion of the population. So I think that this model actually is the one that we have to rethink carefully. And I think there are already people start thinking. I think it's not that we are not aware of it. Even 30 years ago, when I was in medical school, we already know prevention is better than cure, but we just don't actually sort of actively pursue that goal. But now that the impetus is that already, because digital health has just that crucial ability to allow us for prevention. I will elaborate that in a while. So what we need actually now actually is that we need a system that is actually emphasized on wellness. That means instead of waiting people to get sick, we want to maintain them in health. And instead of waiting until they're sick and come to see us, this system should actively go out and actually approach a population and keep them safe. And that is the one. And also the doctor who has always been snowed under by actually disease. And I think a pandemic is actually an extreme example how the healthcare workers are overworked. I think the technology has the ability to supplement it. And I think for those people who are aware, I think the movie Hero, I think if you have seen it, is one of the good example, but actually is obviously animated version, how we can take some load of the doctors and allow doctor to do what is his best, that's to guide the patients. Technology also allow us to actually move the healthcare closer to the patient, to where the patient is. That means to say they don't have to travel, right? And I have done that. I think during the pandemic at time, I have used technology to actively support my patient in Indonesia, Maldives, and Mauritius. So I think that is actually what technology can allow. And we are now beginning to see a lot of technology company coming to say that yes, they are now developing a lot of products to actually support wellness. And in fact, I think that the big change, which I think is significant, is by the paymaster. I think we have actually Prudential and we have AIA, Vitality, and Prudential Pulse as an example how the insurance company are now rethinking their approach into healthcare, and they are now promoting and rewarding people who maintain in healthy, right? So I think that's how the future should change, and that actually is made possible by actually information technology, digital health, because with the digital health we will have the data, and the data can and will be individualized. So that individualization to each patient allow us a precision medicine, predictive medicine, and preventive medicine. So that is the bottom one, is there where I think the future is. I think the evaluation eventually, that's the holy grail, right? And I will not actually embarrass myself by trying to preach what is in IR4. We are now actually obviously in IR4, but IR5 is not very far away. That personalization is on the card. In a similar way, I think the information technology has undergone a revolution, possibly three stages. I briefly put it there, from craftsmanship, industrialization, and digitalization. And most of you are actually in the transition between industrialization and digitalization. However, healthcare being a very conservative industry, we are still just moving away from craftsmanship and industrializations. So I think there is a lot of scope, and no doubt it is behind time. But I think the advantage actually is that we can actually avoid the mistake made by other industry, and healthcare is one that we cannot afford a lot of mistake. So I think that's one thing, and the opportunity is that for those people out in the audience, you have done in other industry, you have the knowledge that apply that to healthcare, right? So how does healthcare in future looks like? I think this is the one that I think the healthcare will be. First of all, I think, yes, I think that's no-brainer. It will be digital and cloud-based in future, right? And it will be decentralized, as I mentioned to you. I'm already supporting a lot of my patients in other states and also in other countries via virtual consultation, and then using the what I call the industrialization and networking to actually deliver the healthcare, the products, and the medicine to the patients, right? Quite important, we think that I think the silo that I've mentioned earlier should be broken, that I think the future healthcare should see the participation of all stakeholders. My vision of a future ward round in the hospital will include a data scientist and a programmer, because we need to look at the patient and we need to individualize it, and we need to be precise, and we need to actually prevent medicine. So all these are actually the realm of a data-driven healthcare, right? And it should be patient-centric, as I mentioned, and then we will deliver healthcare closer to home. And for those who are interested, I can even show you one of the project my PhD student done in virtual rehabilitation using Xbox 360 and middleware to customize Mario to a rehab what I call package that patient can do. And we in fact show that there's an improvement for 2 children who had brain injury 10 years ago and still improved. So we have that. And the last one, subscription model, is something that I will not talk about. It's more a commercial model. And because we are now still very much healthcare pay for service type of model. But I think if other industry, you can see a subscription model is the standard. So that is the future healthcare that we think that it will be. So this is the one that I've shown early on. And I think through this last few slides, you understand why we think that the triple helix model of innovation should be the way forward. That I think that at least three, what they call stakeholder, the policymaker, the industry, the researcher and provider should come together. Right. So that's the one that the DHM has been actively promoting. Right. And see, one of the concepts that we have, we call it PACES Online. And that's the one that I have been discussing with the economic planning unit on how we can actually drive a care to the patient-centric services, addressing all the pain that I have illustrated early on. Right. And so what we think actually is that we actually will want to Uberize the healthcare, right? Have an open, inclusive platform underpinned by a patient health record, where all the stakeholders, they are involved in the care of patient, being the provider, the industry, or the researcher, right? They can deliver whatever product, whatever services and expertise they have to improve healthcare to the patient on the other end. And because this platform is open and centralized, by doing so, we can centralize the health record, because that is a big issue that we have, that a lot of time now, the records are all scattered all over the place, and all hospitals don't talk to each other, don't share the record, and that resulted in duplication of service, duplication of investigation, and also duplication of treatment. So I think this is the system that we want to do. And how do we come about actually is that I think for those audience here, if you're interested and you think that, hey, I have some product that I want to do, how do I go about that? So what we try to propose actually is that if you have a product, an idea, or a certain treatment modality, then it is up to you to work out a viable model and roll it out. I think for me, for example, I'm a pediatric neurologist, I specialize in the disorder of the children's brain. Then epilepsy is what I'm interested on, and being pediatrician, child health and growth and development is my interest. So, and I'm actively now doing something I will show you in a while. And for those who are diabetic, what we call endocrinologists, then they can think about services. Then if you have actually, for example, something that can actually predict heart attack, then work out a model. Then we can see how you can introduce that through this. And I'll explain to you a bit more detail about that. So I think, so you work out a model yourself and then deliver that model offered to the patients on the other end through the platform. By doing so, we actually can centralize the record. And that's what we are trying to propose, the idea. I think, for example, in the epilepsy that I was telling you about, I think that I am now in the process of doing an electronic diary that's linked to treatment. And that will tell us how actually the medication that we started lead to reduction or no reduction of epilepsy, so whether it worked or not. And then there is actually a discussion I have with the Belgium research house to see how we can actually develop wearables to predict epilepsy. And I'm actually working with a local E&E company to actually using AI to interpret EEG, I mean, it's an electroencephalogram, to use to diagnose epilepsy. We are now in the process of trying to how to use the AI to support the doctor in actually narrowing the EEG in diagnosing epilepsy. So I think these are a few things that we are thinking about. And once I get all that together, right, the next thing I want to do actually then to actually roll it out through the platform. And if it works, then that's fine. If it doesn't work, then for me to go away. So that means that everybody have a chance to develop a commercially sustainable, viable, and profitable idea and roll it through the platform. Right. Okay. And in a similar way, the researcher, all right, either the academicians or individual can develop a product, right? And then actually offer that to the patient through this platform. Now, the last one, which is interesting, is industry. I think industry is the one that most of you can relate to. I think the industry can come in a different way. So, for example, you might have a product. If you have a product that's directly relevant to patient, then you can then offer the product to the patient via this platform. On the other hand, this platform being an IT platform, we know that we need a few crucial components, right? So, and then this component, the products, devices, application, communication, storage, or data analysis are all the vital components that makes up an IT platform. Right. And so, and you may not have a product that you can offer to the patient, but you might have an expertise in some of these components. So when you have that, then you can then offer your expertise to improve the component. And when that component, which is made available to all the other stakeholders to provide services, if that component is used to actually offer to the patient, then the revenue generated from this venture then will be shared, and you will be benefit. You will benefit from that what I call participation. So industry, you can actually then actually participate in this whole ecosystem that we have in mind through these two. One actually is offered to the patient directly, the other is offered to the platform indirectly. So I think that's how we see it. So I think coming back, so I think this is a very simplistic view how I see the PACEs should work in the future, how we can promote an open ecosystem and inclusive where all the stakeholders coming together. So I think I've taken a little bit more time. So I'm going to stop here and back to you, Karen and Jennifer.
Yes, thank you, Professor Dr. Wong. I didn't stop you because I found the presentation and your insights were so valuable and very interesting. So that's why I just let you speak. And I'm sure the audience will be feeling, will view the same. Before I pass to Dr. Sanjeev, Professor, I think there's one question here direct to you. Perhaps we can just take that question. It's a question from Royston. Do you envisage passing the control of patients' access to services via their smartphone so that they can manage their identity and security using technologies such as blockchain? Your thoughts on this?
Oh, definitely. I think that we are thinking that healthcare should be almost like the fintech technology that now we can do banking online. Now, banking is more data sensitive. Security is absolute crucial in what I call banking, where lots of money involved. And if banking can do that, why not us? We are thinking along that line that actually the mobile phone will be an enabler.
Thank you. Thank you. I think that answers the question very well. I do have some questions, but we'll keep it for the panel discussions. So now we will move on to our next speaker, Dr. Sanjeev Panchal, who is the country president of AstraZeneca. And he's also, I'm proud to say, a board member of the BMCC. But before I pass the mic to Dr. Sanjeev, Jay, can I just take a few seconds or few minutes I'll make it very short, to share about his profile. Okay. Dr. Sanjeev, I think Dr. Sanjeev, as I mentioned, is the country president for AstraZeneca Malaysia. In his role, he's responsible for managing the overall company operations, driving a patient-centric culture. That's excellent. That's what we all want, a patient-centric. Dr. Wong also spoke about it. And leading a high-performing team. Sanjay brings to his role his strength of strategic thinking, experience in emerging markets, and diverse leadership. Having worked in various roles and across regions, Sanjeev joined AstraZeneca in 2003, and one of Sanjeev's strongest assets is his ability to strive in a diverse environment, assume challenging assignments, and work with different cultures. He has held leadership positions across sales and marketing within India, Indonesia, before moving to regional Asia Pacific, in Singapore, now in Malaysia, and international region in the UK. So with that, Sanjeev, I pass the floor to you, Dr. Sanjeev Panchal. Sorry, Sanjeev, I'm always not pronouncing your name. Forgive me for that. But over to you, Sanjeev.
Thank you, Jennifer, and thank you, Dr. Wong, for such a great session. It's very insightful,
Yes.
and I hope I can talk about what we are doing and how we are, almost aligned on the patient centricity part together. Um, so let me talk about a little, one or two slides on AstraZeneca, and then especially focusing on what we are doing in digital healthcare in Malaysia for Malaysia. Um, so what we are, so I think our main purpose of being as an organization is to push the boundaries of science to deliver life-changing medicines, and we are really inspired by our values and what science can do. And we are really focusing on accelerating the delivery of life-changing medicines that create an enduring value for patients and society, and this is both for globally and in Malaysia. So we are very a patient-centric organization, and we really follow science to ensure that we are delivering this across the world. In terms of, as a company broadly, we are a global science-led, patient-focused biopharmaceutical company, very driven by science and innovation, and I'll talk about that in a minute. We have a broad R&D platform, but we focus on three main therapy areas, specifically on non-communicable disease, which is, let's say, cardiovascular, renal, metabolism, oncology, and also respiratory and immunology. We also have our portfolios, which is both specialty care and primary care. That means we cover a broad spectrum of disease in these therapy areas. And also we have a very strong presence across the globe with strength in China and emerging markets in Malaysia is part of the remit which I look for. So just to how long we have been in Malaysia, I think we are celebrating 40 years in Malaysia this year. And we really believe that we have been strengthening our footprint for the country, for the people of Malaysia, and for the patients, really delivering life-changing medicines. We recently actually announced $500 million ringgit, which is equivalent to $125 million investment over 5 years from 2019 to 2023. And these have been focusing on three things. One is patient centricity, what we can do more there. Number two is innovation. And number three is talent. So we have been working on this, and I'll give you some examples what we have done this year over the past, working over the past year or so. We also have global finance services. We have three big centers across the globe, and AstraZeneca has one of the centers for global finance services in Malaysia, which really shows our footprint in Malaysia and the belief in Malaysia investing in this country. More than 500 employees, which also means that we are developing local talents. We're investing in clinical trials, and we are engaging in building capacity of the healthcare professionals by having different program as we get the new science, and we can bring that new science to the doctors. And we also ensure that we make our drugs affordable for the country based on the GNI. So let me talk about a little bit about how we are, what has been changing, and this is very specifically to focus on how the healthcare has changed over the previous year, let's say, and you will see there has been a global economic shock. The overall GDP is less than 5.3 pre-pandemic projection, so which really shows that there has been an impact of COVID across the world and also in this country. The second piece is the whole population is growing and aging, and we can see that more than 2 billion people will be aged 60 plus by 2050. The most important point I would say is the increased burden of chronic disease. And if you see here, the more than 42 million people die from NCDs each year. And when we were looking at data which has been published, in Malaysia itself, the NCD is a disease burden which is very high, and specifically diabetes, which is the prevalence is above 18%. But we also saw that the mortality rates were higher for patients who were with diabetes. We know that the immune system is not that strong for these patients. So NCD is a big concern. And we also see that this is an important area and a government agenda to focus on non-communicable disease. There has been digital and technical breakthroughs, and we see that this will grow faster. The whole COVID has just accelerated how to bring digital into our life, but also into the healthcare system. And we would see this nearly 6 times by 2026. And the impact of COVID, of course, in many patients in US, EU, Asia, either deferred or canceled treatment schedule early in the pandemic, which is not good. The cancer will stay, and the follow-up of the patient, if it is not there or it is being canceled, or let's say the surgeries have been delayed, this has a big impact on the patients. And COVID has shown that impact, which has also caused towards delay in treatment, or really having more patients getting to a severity of the disease. So what we do, I think, just to give a slight context, that what we do as a company is, as I was hearing the professor, that we are not focused. We have changed our focus as a company to only on treatment part of patient journey, but focus on the whole patient journey itself. So the traditional focus of an industry would be to bring the treatment of innovative medicine and digital therapeutics, but AstraZeneca has turned that focus to say, okay, what we can do across the patient journey, which also includes the wellness part, which Professor spoke about. But how do we bring digital into the prevention and awareness and diagnosis by using, let's say, the AI technology or AI-enabled virtual health assessment services? And I'll give you an example what we have done in Malaysia. So how do we want to do this? Have a really thoughtful consideration or coordination of digital patient services partner ecosystem. And AstraZeneca, we really believe that we can't achieve what we want to achieve alone, and therefore we need to build an ecosystem and really partner with different stakeholders to bring this to life. So patient centricity is at the center, and the point I really want to make, we are just not about the treatment. We really want to look at the whole patient journey and put really patient as people first when we are making the decision for the patients. So I'll talk about one. We introduced something called as A Catalyst Network, which is a home for patient-enabled innovation. And what is this? Which Professor Dr. Wong was talking about. We are really bringing an open ecosystem across the world. So we have a strength in science, in R&D, and we believe that the presence globally across the world can help us to bring this knowledge across different countries. And what we really want to do is to leverage some of the unique potential of individual hubs. We are creating individual hubs across the world, and we have about 20 hubs, innovation hub, we call them, as we started with, but now we are calling them A Catalyst Network. But the idea is to join different innovation hubs or the A Catalyst Network to enable innovation in different countries. And we believe that with this, we should be able to create a global network of physical locations and also virtual partnerships between patients, healthcare practitioners, government policymakers, academia, technical and pharma industries, ecosystem builders, investors, and entrepreneurs. So I think this is something which we have started about 2 years back. And we are very happy to share in a minute that we brought this hub into Malaysia as well in April of this year. But the idea is that I think with this digital technology and digital innovation which is happening, we need to keep patient at the center, but we can't achieve everything alone. We have to have more partner and create an ecosystem which looks across the patient journey rather focusing on the pill, and we have to go really beyond the pill. So this is the overall network which we have created, and you will see different types of hubs. We have emerging market health innovation hub, and you could see Malaysia in blue. So we have an actual hub there. We have hub in Europe and Canada health, Canada, US hub, and also Japan hub. So it was very pleased to see that we could do this for Malaysia, although we were during the pandemic, but we believe that the government agenda and accelerating digital for Malaysia, for this country, we are able to bring Malaysia into the map of this A Catalyst network. So there are two things which we have done in this one. So first is in April 2021, we launched first innovation hub in Malaysia, which is in line with government's call for digital innovation in the healthcare sector. And the hub actually will empower local startups and innovators to deliver new sustainable solution and support the patient experience. So I'll talk a little bit about in a minute, but this is one hub which we have worked with Sunway to collaborate with them and other partners to Malaysia. The second is about Kiro AI. This is one of the AI technology company, a startup company, which is now have a good presence across the world. and we have partnered with them. We formalize a partnership at an international level. And what they do is to really use the QXR technology to identify incidental pulmonary nodules through a second reading of chest X-rays. And as of now, we have started this in Brazil, and very happy to say that we launched this in Malaysia just 2 months back. And especially in this part of the world, it is still only Malaysia and Philippines. And when we launched this in June, we had already 400 X-rays done, which is just at the launch time, and we are already reaching 1,000 X-ray reading. Now, what we are helping here is to improve patient outcomes through earlier diagnosis. Again, if we recall the patient journey, we are not talking about treatment here. We are really talking about how do we bring awareness earlier, and earlier diagnosis can really help the patient in their patient journey. So, one example here, what we did in Innovation Hub. Before we launched this hub in Malaysia, we actually partnered with the Embassy of Sweden, Business Sweden, Sunway Eye Labs, which is from Sunway Group, and the government bodies, which is Magic and MDEC. So what we did, we defined a problem statement, and we also worked with the Ministry of Health to understand NCD is the biggest problem. So what is the problem statement? And we called out a digital health innovation challenge. And this innovation challenge invited many startups. So we had about 15 to 18 startups who participated in this challenge, and they gave some solutions. And there were an assessment of these startups, and there were 8 winners who were announced, and they have gone through different type of mentorship from AstraZeneca or from Sunway. So what we are really trying to do, we are starting to bring this innovation and digital health innovation challenge into Malaysia, and with this, it will spur a new sets of startups who can bring solutions to the challenges which the country is facing. And we really focused as of now only on non-communicable disease, because that is the biggest disease burden and the agenda for the government. So this was a great thing. We had Professor Sibra from Sunway University, our DDG there, Swedish ambassador. We were doing the signing ceremony, and we had our minister who also spoke about this, gave a speech during this opening. So this is the first health innovation hub, and I'm pleased that this is brought to Malaysia, and we are amongst now top 20 hubs being planned across the world from AstraZeneca. It really supports the primary care ecosystem, and we would understand, the audience will also understand, if we don't make a primary care ecosystem very strong, it is difficult to manage the patient at the later stage. So the more stronger our primary care ecosystem is, the better awareness and diagnosis, we can make a healthier Malaysia, and we can reduce the burden of public health at the later part of the stage. We ensure that we align with government priorities, and we are focusing on NCDs, and we are really bringing new technologies into the patient pathway to combat the impact of non-communicable disease. So this is one starting point, and I think it's the start of a journey. It will take a lot of time, and we need more partners to bring more solutions together. That's one. The second one, also we again launched for the AI technology into the, and this again, as I said, Malaysia is one of the countries in emerging markets after Brazil and Philippines in another country. Here, what we launched is partnered with multiple stakeholders. So we understood the problem in cancer, and we are working with Lung Cancer Network Malaysia, which is an NGO. But the biggest problem there is that the lung cancer detect is at late stage, which is a huge burden both for the patient, the emotional burden, and also the burden on the health system itself, and also on the economics of the country, and also the livelihood of the patient. So what we are trying to do is to how do we improve the lung cancer survival, and we believe this can only be done if we can detect lung cancer at an early stage. Now, the early stage thing is really possible at a primary care ecosystem level, and we thought that how we can complement the radiologist assessment of the X-ray, and we can have a second reading, and then further assessed by radiologists, and do some referrals if we find any pulmonary nodules. So we launched this with the Lung Cancer Network Malaysia. We partnered with Qualitas Group, and you see the chairman there from the Qualitas Group. And we also have Cura AI, who are the AI technology company, and they have some patented technologies which to read the X-rays. And again, this was supported by, witnessed by DDG, as you can see there. So the idea again here is, how do we do multi-center partnership, find a solution, find a problem which is deep enough and it can have a bigger impact if we make a change, and how do we bring digital innovation into this technology, and most recently like artificial intelligence. So what we would do is to incorporate these AI tools in primary care clinics. This will improve to detect the nodules, and it will improve the referral diagnostic pathway for patient, and it will help to shift the detection of the early stage cancer at the earlier part, which is we were talking about prevention and awareness. So if you can do this really well, both from an NCD perspective and also from a lung cancer perspective, I think we can make a very good contribution to the overall health of Malaysia and improving outcomes for the patient. So again, this was launched in I think May or June perspective. So two big things which we have done from a digital perspective: one, bringing the innovation hub, we call it A Catalyst Network, creating an open ecosystem, bring in more partners, and here is testing the AI technology in form of detecting lung cancer. And this is just an example of what really happens is, there is a chest X-ray, there could be a chest X-ray which is available, or the chest X-ray can be seen from with a picture, and you would see that you can actually find the nodules which is there, and this can be then validated by a radiologist, and if you believe if everything is fine, it is good. If not, that can be referred from a primary care physician to an expert to do a better thing, a better diagnostic, and improve the outcome. So again, we are really using technology on ground, and this is just the beginning, and we need to go far, but we really see an opportunity to improve the healthcare at a primary care level and across the patient journey, including the wellness, and help the outcomes for patients in Malaysia. In summary, my last slide, I think, as Professor Wong also said, that partnership is very important. So we are really working with partnership. In summary, we worked with Innovation Hub, we are working with lung cancer, we are working on AI technology, and we have recently also launched a Beyond Sugar campaign with sustainability in diabetes management. So overall, we believe as an AstraZeneca, as a company, we are not only treatment focused, we are really focused across the patient journey. And our effort has now been moving towards traditional focus of treatment to prevention and diagnosis. And we are really bringing innovation in healthcare to improve the outcome across the world, but also in Malaysia. And that's what we believe what science can do for the patients, for the country, and for the people of this world and Malaysia. So that's all from my side. So thank you so much for your kind attention.
Thank you, Dr. Sanjeev. Dr. Sanjeev, thank you so much. And I think you have thank you for sharing about innovative and digital solutions. It's fantastic solutions, and I really like the point that you keep on mentioning about being patient centric, and that's what you're aiming. And really proud to see AstraZeneca is already implementing what Dr. Wong has earlier said about moving towards patient-centric instead of focusing on disease-based and also treatment-based, right? So, thank you again. So now we will move on to the panel discussion, and joining Professor Dr. Wong and Dr. Sanjeev is Dr. Raymond Choy. Dr. Raymond, welcome. You were in the background, but welcome now. And before we start our panel session, I must take this opportunity to give you some time to share about yourself, importantly about doctors to us. But before that, let me just, for the audience benefit, share a bit of background about yourself, a quick background about yourself. Dr. Raymond Choy co-founded Doctors to Us with his partner Jack in 2014, December, and incorporated Hey Doc International in April 2015. So the idea of Doctors to You, I would not share, but let me just, Dr. Choy is a medical practitioner specializing in family medicine and aviation medicine. Very interesting. Dr. Choy started his foray in the field of medicine at IMU in 2003, graduated from the University of Manchester with a Bachelor of Medicine and Bachelor of surgery. Upon graduation, he received his medical training in John Radcliffe Hospitals, Oxford, UK for 3 years, and was given an opportunity to pursue his career in Raffles Medical Group in Singapore. So with that, I guess now he's back in Malaysia and, introducing Doc to you. Can I pass the floor to Dr. Choy for your presentation before we move to the panel discussion and take questions from the floor?
Thank you, Jennifer. Hi, good afternoon, everyone. My name is Raymond from Talk to Us, which sounds like Talk to Us. So basically, just a quick overview of what we do, and because from Prof. Wong and and Dr. Sanjeev, and we are talking about very high level. So my level is actually at the industry grassroots level. So we are serving the patient, providing patient-centric and value-based care services to the patient in a virtual platform. Right. So we are actually the telemedicine platform providing online consultation services, e-prescription services, medication delivery services, and even a little bit of a blockchain technology on the electronic health record and so on and so forth. Right. So and as we actually there are quite a number of players in the telemedicine market, and each of them actually are unique in their own ecosystem, because if you look at the vertical solution itself, telemedicine or teleconsult, you can't really differentiate, right? It's just like, you go to e-commerce, you go to Shopee and Lazada, they are the same, right, in terms of the functionality. So likewise, what actually is important is a whole ecosystem. So for Doc2Us, what we have built since 2017 is actually, we have a teleconsult arm where we provide the teleconsultation services to the patient, international patient, as well as the corporate employees. At the same time, we have the whole Netflix e-pharmacy solution, so to speak, the subscription model for all our pharmacy partners to actually, virtual to digitalize their prescribing and dispensing services, right? So in a way, we are bringing NHS of UK to Malaysia, providing the dispensing separation, where the doctors will prescribe online and remotely, while the pharmacy, central pharmacy, or the selected outlet, right, will be receiving the e-prescription in real time, because all these are cloud computing, and dispensed digitally to the patients and dispatched to the patient accordingly. But having said that, we are the health tech company. In healthcare, the two speakers mentioned, right? When you talk about patient-centric, you can't run away from personal touch, right? So hence, we are the strong believer in hybrid care model, whereby online and offline work closely together. So if you look at our consumer healthcare on the left side, as part of the ecosystem, we have a clinic business. So we venture into clinic, which is a physical clinic. We have the on-site and home care services, health screening, flu vaccination programs, and COVID-19 screening, and even vaccination program, working with the federal as well as the state government to provide, to be part of this vaccination program this year. And so we also provide a lot of on-site, and because of our outreach medical team and working with the online team as well. So on top, we have all the content services where we actually generate a lot of health articles and work with a different pharma company to run some campaigns, awareness, and whatnot via this digital channel, right? So in terms of services, as you can see, telemedicine, more or less, all the telemedicine providers are almost the same. They provide live text chat, video consult, e-prescription, and at the moment, the e-prescription that we're using is actually in compliance to what Ministry of Health required, which is using digital signature system. So as we speak right now, every 1 minute, we are generating one e-prescription, and today I think we have done more than 500,000 electronic prescriptions for our patients in Malaysia. And of course, the two speakers actually also talk about electronic health record, the banking industry. You're right. So we also started using blockchain technology since 2018 on our bio data. So all our patients' records, they are all managed in a secure system under the blockchain technology. Of course, I'm not the expert of blockchain, so there's a CTO's job. But so basically, we are still experimenting this blockchain, the viability of using blockchain technology on electronic health records. And of course, we also play a little bit of AI on the skin cancer detection, working with New Zealand companies, and yeah. Okay, so these are some of our milestones, and then our base, and as I mentioned earlier. So we also do national medication delivery services, and same-day delivery service, express delivery in 7 major cities. And these are very interesting. I will talk about digital healthcare solution, right? We started in 2017, and that year we did less than 500 e-prescriptions, right? And in 2018, we started, changing the model to B2B, right? So we serve our very first customer, which is Hong Leong Bank. And from there, we actually generated about 5.5K of e-prescription that year. And because of Hong Leong Bank joining, being the first in the market, right, being the corporate using telemedicine services for their employee, and we saw a lot of other, corporate companies coming into telemedicine, providing a virtual services for their employees, right? So because of that, in 2019, we saw a huge leap of e-prescription usage to almost 90,000. And last year, because of a lot of pharmacies joining the platform, using our services, as well as more corporate clients and employees using the services, we saw about 160% increase due to pandemic outbreak partly. And that, last year alone, we did about 232,000 electronic prescriptions. Yeah. So as you can see, the trend is on upgoing. And if we look at the whole digital healthcare solution adoption, right, in terms of telemedicine, in China alone, the top 2 players, we are looking at 900% increase of adoption during this pandemic outbreak. And in this region, Singapore, Indonesia, we're looking at average about 150% during pandemic outbreak in terms of increased adoption of telemedicine services. And for ourselves in Malaysia, we're looking at 40 to 70% and still uptrending. And this is some of the company benefits why they're using telemedicine services. Of course, more cost effective, more convenient, easily accessible. There's some of strategic partners that we're working with. Yep. So some of the pharmacy that we're working with and using our solution. And because of pandemic outbreak, actually we rally more than 120 voluntary task force since last year, who actually step forward to actually help to provide virtual health advisory to the public on COVID-19. And this is with the aim to actually help to reduce some load of the government and hospital. So every day we're seeing hundreds of cases, and right now we're seeing even close to 1,000 cases via MySejahtera. So because our cases are 20,000 cases, and that's where the virtual health advisory under the digital health in MySejahtera actually comes in place. Then you can connect to doctors, and we are able to provide advisory. It can be from the logistic to being positive at home. What should I do? And after vaccination of certain brands, which is the best brand, a lot of different questions people ask our healthcare providers. And our frontliners, virtual frontliners, they are able to actually provide 24 hours free virtual advisory services to the public. Yeah. And at the same time, we also participate in the national vaccination program. So we actually provided 27 PPV sites, vaccinating more than 500,000 doses to date at the moment. Yeah. So this doing a little part to help the country in fight with this pandemic outbreak. Yeah, so that's a little bit about Doc to Us, and I think I'll back to you, Jennifer. Thank you very much.
Thank you, Dr. Raymond. Congratulations on what you have achieved in this short period of time, and also thank you for the support on the PPVs and the rollout of the vaccination program. As the three of you were speaking, one thought that came to my mind was affordability in healthcare. When you talk about digital and innovation, and in terms of technology, improvement in technology, the cost of healthcare will increase, right? But in all your presentations, you say that affordability will be managed with digitalization, because today when we go into private hospitals and also insurance, tend to charge a lot, right? Especially the balance and everything. So your views on that, how do you see as digital healthcare reducing the cost of healthcare for patients themselves, right? I want to start with, I know this is a question that I think it'll be in the mind of many people at the moment watching, because innovation, like Sanjeev talked about, innovation in early diagnosis for cancer and all, these kind of instruments and this kind of medical devices are expensive, right? So that will accelerate medical care, healthcare. So over to you, my panelist. But Dr. Wong first.
Yeah. I start first. Okay, now I think I was glancing too fast in my slide. I think prevention is the key. I think, because I think if you look and say, right, I think we take the case of diabetes. Now, if you have diabetes, right? I think the first year, maybe we can say, yes, I need to start you on treatment. I need to start what I call medication first. But if you don't treat it well, then you have complication, your eye complication, your kidney complication, your heart complications. And then eventually you have infection, then you have amputation of the leg because the wound will not heal. So these are costs. However, if a person that's going towards being a diabetic, we call it pre-diabetic, there's a chance to sort of reverse the process. And that process reversal will be data-driven, meaning to say that if I have a record of a patient of mine and I find that his weight is going up to the roof and that his diet is poor and so on, if I can take him from pre-diabetic to normal by a good diet and good what I call exercise and maintain his weight, how much would that cost me? So that cost is a fraction of the cost. For example, in UK, a cost of a diabetic patient is about £10,000 per year. But if I manage his diet, give him some incentive to maintain his health, his exercise, that's only a fraction of the 10,000. So cost can be driven down. That's my take on that.
Thank you. So it's about preventive. It's very important, and wellness. I see. Yes.
Exactly.
Yes. That's a very key point for all of us. Dr. Sanjeev, your view, please.
Yeah, I think absolutely. As I said, that we are moving, our traditional thinking is moving from just treatment. And if you look at treatment is always expensive. And later we go, the severity of diseases increases, the treatment becomes more and more expensive and the test costs are higher. I think the model which we have to develop is how do we diagnose people early so that we can make a change and not allow the disease to progress further. And let's say if you want to see an X-ray is not very expensive. And if you use a technology like AI, it is even lesser expensive to find much earlier. Or let's say, as Professor said, if we can get the testing of diabetes patient for early heart failure signals or kidney deterioration signal much early. Imagine the patient later on getting into dialysis is such a disease burden. And that part is expensive. So what we're really trying to do is to bring the awareness, diagnosis, and to an extent prevention as much as possible, which will reduce the cost burden. Because in early stage, the cost is very less. As we go late part of the stage, it will be expensive as we go ahead. More tests, more medications. Take the cancer thing, right? If it is 3 and 4, the drugs will be expensive. But if you can diagnose it so early, which is a simple AI X-ray, and you can find out so early, imagine the disease burden and the burden on the patient and healthcare system is so huge, it can be really reduced. But that's a journey, right? And that's where digital can help us to strengthen the position of the companies. Yeah.
Thank you. Dr. Raymond, would you like to add anything to that?
Yeah, so I'm agreeable to the both speakers, and I think when we talk about cost effectiveness, we talk about the short-term saving and the long-term saving, right? But ultimately, it goes back to the patient-centric care, where we always call it the value-based care. And value-based care is defined as there's a formula that quality of care multiplied by outcome of care divided by cost, right? So the higher the cost, right, the lower the value, right? So the better the outcome and the quality of care, the better the value. So definitely for any innovation or technology, we are aiming this formula, right, for better quality, better outcome, and of course at a lower cost. And only then we are able to provide, value-based care. I'll give an example. You look at DNA testing, right? Maybe 20 years ago, it cost a bomb, right? But until right now, I think almost everyone is able to afford, right? Because it is getting more and more common, and more players coming into place to innovate, to make it better, surer, safer, and of course cheaper, right? So ultimately, like what Dr. Wong said, preventive is a key, because if you can prevent certain complication of diseases, then you actually will be having cost saving, long-term cost saving in the future. But short-term cost saving, it takes time for you to see, because any new innovation, AI, it can be quite costly as we first implement due to the R&D in place, right? Yeah. So it goes back to the common thing, which is prevention is always better than cure. Yeah.
Good point. So moving on from that, I would like to bring some questions into discussion on the healthcare ecosystem itself, that the current healthcare ecosystem. Dr. Sanjeev, you spoke about it's important to create a reliable ecosystem and multi-sector partnerships. And Dr. Wong, you also spoke about the importance of the three stakeholders coming together to collaborate: academia, industry, and government. So, my question to you, gentlemen, is how ready is Malaysia's healthcare ecosystem? Or do we have a system already in place that needs to be enhanced? So your views, please.
Right. Do I go first?
Yes, sorry
Okay.
about that.
As always.
Right, okay.
Professor, you go first.
Has to answer.
All right. Okay. Yeah. I think that we do not have a system in place already, not yet. The answer is, but we are moving that. I think if you look and see, that's what we've been working for the last 7 years. I think Raymond has been with us for most part of the journey. That we start with telemedicine development group. We advise the Ministry of Health and also MCMC on how best to do it and so on. We work very closely with Dr. Fazila, the e-health director in MOH. So definitely the collaboration has begun. The government initially was trying to only digitize the Ministry of Health alone. But we know that just before the pandemic, there was already a move to make the private sector collaborate to have data integration. That means data exchange and so on. So I think that we haven't got a system yet, but the awareness is there and the effort is there. Pandemic has pushed it back a little bit, but hopefully that when we see the end of pandemic, we will take it from where we left off.
Okay, thank you. Dr. Raymond, would you like to add anything?
Oh,
I mean, you have
Dr.
gone
Sanjeev.
into the, I'm sure you had your own, struggles when you entered the market because of the ecosystem.
Yeah, I think how ready we are, it depends on what context we are in. If you compare to 10 years ago, we are more ready than 10 years ago. But if you compare to Singapore, we are not, right? Infrastructure, ecosystem-wise, definitely we are not ready. Right? When I talk about whole infrastructure ecosystem, it involves the policy, right? And the whole infrastructure, the funding infrastructure, things like that, right? So all this add on together will help to drive the innovation even quicker and faster. But relatively, I think we are definitely quite behind to some countries, right? But also, of course, we also ahead of certain countries, right? It depends on what context we are in, relatively. And when we first entered the market in 2017, providing virtual consultation, I think we were a few steps ahead of the general population, where in Malaysia, accessibility of care in majority of places are not an issue. Why would I pay, an online doctor for not even getting a single pill of Panadol, right? So I can just go to any, I can go to Sunway, medical centers or even clinics, right? So because of that, after 2 to 3 months, we pivoted to B2B. So we actually, found a solution. We found pain points for the pharmacy as well as a corporate. So we are very B2B and B2B2C, working with pharma company, things like that. So I think the readiness, I think like what Prof. Wong mentioned, a lot of work has been done for the past 7 years. But I think somehow this pandemic outbreak, actually slowed down the whole ecosystem as well as the policy part, because there should be a framework implemented this year, right? But somehow it got pushed to maybe next year, hopefully. But having said that, even though Singapore right now, they still haven't had any gazetted a law on act, the healthcare act, right? Online healthcare act, which is supposed to be tabled I think next year. So we are not that far, right? But I think we are seeing more and more innovators coming in. Look at AZAC. They joined the part of the innovation hub, and all these are very encouraging. That they move the whole industry towards a more innovative industry. Yeah.
Yes.
Can I just add one more thing? I think one of the crucial things that has actually happened during pandemic is our adoption or our readiness or willingness to adopt digital.
Yes.
And that actually is a big part, and that I think we will never achieve how we have achieved in the last 1.5 years. I think we probably take us another few good years before we can achieve that. And that is a very important part that will set the thing. I think that unfortunately, for one of better thing, and this is something good that came out from the pandemic, is the people's willingness to adopt digital health.
Yes. the mindset to change, right? And because of,
Correct,
we
correct,
want to
yeah.
protect ourselves. So on that question, I was, on that point, I will segue to some questions regarding digital versus human touch, right? So, is this digital healthcare, you just mentioned because of the pandemic, people's willingness to, to be more responsive or more adaptive to digital. Is this something to stay? Maybe Dr. Raymond, you can answer this. Is it something to stay post-pandemic, as the perception is that patients will still prefer the human element, touch and interaction, human support? I want to see my doctor face to face, right? So, your view on that. And Sanjeev, you can add on since you're coming from AstraZeneca side, right? So, Dr. Raymond, to you.
Yeah, I think that's a very good question. I mean, as a human, we are not robots. We need interaction, we need touch, we need someone to practice empathy, right? Especially when it comes to healthcare providers. So definitely, I think the technology is not going to replace the human element of it, especially when it comes to healthcare, where it's very personalized, a very private, kind of action, right? So, but having said that, because of this pandemic, it actually catalyzed the whole adoption of technology, the online healthcare services inside that, right? Digital healthcare. And with the technology here to stay, the answer is yes. The technology is definitely here to stay. It's a matter of how we adopt it and how we utilize it, right? So right now, I still think we are in the awareness and education stage, right? For instance, for our telemedicine services, right? We're still in the awareness and education stage where we still need to, keep educating the public and even the healthcare providers, right? The industry players that, there's still a lot of things that can be done via telemedicine, telehealth, but there's still a lot of things that can't be done. You need to go for physical, right? So we are in this stage, right, to educate but definitely, I think the online healthcare services, the digital healthcare is here to complement the whole healthcare journey of the patient as well as the healthcare providers, right? So that's my personal view on this technology. Yeah.
Yes. Dr. Sanjeev or Professor, would you like to add any points to that?
I would just
I'll
say,
leave
I
it,
think,
Dr. Sanjay. Yeah.
yeah, okay, I can start. I think it will be a hybrid system. And what we have learned during this COVID thing, that just because we only want to have human touch, what will happen is we can't leave. We have left so many patients behind because patients want to see the doctor, and it has left so many people, patients, not to even see a doctor and do any follow-up. So that showed us that there is a gap in the system, that if something like this happen, the patients still need to be engaged. So the rules of engagement will change. It will be a combination of human touch, but also use digital to complement it, because that piece has left patient vulnerable. And we can't in future leave this patient vulnerable. So you need to have a follow-up, but let's say a human touch in terms of first diagnosing a patient, but we need to follow this by digital. Otherwise, the follow-up will be lost, and then we would see more patient vulnerable, and it will cause more mortality burden. So I would say, going ahead, it has to be a combination. And it will bring both convenience, but also not leave people vulnerable if they're not really able to go to the doctor. So we need to have a mechanism in place that it has to have the patient in the mind, and the rules of engagement needs to be there both. Somewhere you need to diagnose, right? But you can bring home care at home, and today you can actually bring testing at home. So it can still be the human touch, but we can't leave patient in the journey not having anything. Sometimes we had neither human touch and neither digital touch. So both were leaving the patient vulnerable.
Thank you. Yeah. So I will go on to a related question to what we have been discussing in terms of human touch versus digital. It's from our audience, from Evian Tan. She asked if I would be interested to hear the panelists' view on the roles of patient support groups in driving digital health in Malaysia. How do you envisage patients' voices are heard in the context of developing patient-centric solutions? Your views, please. Thank you. Professor, maybe you can take on this question.
Sure. I think so. I think now, if you look and see, social media is very powerful. I think that's the most important thing that we have to acknowledge, that in future, I think the social media will play a big part. And with social media comes the opinion and what I call the suggestions. So the patient groups become very important and become an advocate. I think just coming back to the question before that, the human touch, the people, and so on. I'm already sort of experiencing it myself. For example, as a pediatric neurologist, I see patients long term with epilepsy, and so I divide them into what I call a few things, and I actively encourage them to seek support. So that means to say that I ask them to look for help, look for information, and seek support, and then verify the information. That is the most important thing. I think verify it, because we are worried about, I take the case of vaccination, the anti-vaxxer who try to influence people. So patient group is definitely important because they can point the right way, but a wrong information will bring you down the wrong path as well. So I think that because of that, I find that yes, patient group is here to stay. They play a very important part. Then we need to support that group so that by us who has the knowledge to support, to provide the information and guidance, then this group will then provide a good support to the patients.
Thank you. So that goes to another question in terms of the clinical quality. How do you, maybe Dr. Raymond, you can answer this. How do you manage the clinical quality when you're giving advice? How do you control the quality, the clinical quality of advice given by your doctors via telemedicine or teleconsultation?
Yeah, I think this is a very important question and relevant question, because we're dealing with the health and safety of patients. It really goes down to the clinical governance, be it is a physical or the online, right? So it's really about your SOPs, your protocols, and your policy, right? And the good thing about digitalization is, all these records can be studied and captured, right? Because they're all structured data, as opposed to your physical visit that actually a lot of times is between you and the physicians, that things might not be able to record. Of course, nowadays we have an EMR where the doctors actually transfer the conversation into the EMR. But for online consultation, for instance, right, or e-prescription, we can actually study the whole, behaviors on even the prescribing and dispensing behavior. So we are trying to really reduce the prescribing and dispensing errors, right, based on all these digitalization initiative. And ultimately, the standard of care, it shouldn't be any lower than your physical care. And this is our bare minimum. And also for ourselves, actually, we are very stringent, protocols on how to practice telemedicine. We do regular audits on most of the cases. And so that is the good part of digitalization, whereby everything is structured. It's easier to retrieve if you want to study certain cases. And going back to your previous question, right? So you talk about patient support group, which I am aligned to Dr. Wong, that social medias will be one of them, and really it's about the patient engagement. And engagement, we always talk about 3 E's, right? So it's how we actually empower the patient, right? Encourage the patient when they're doing well. And of course, you have to enforce them sometimes, right? If they're not taking medication, you have to enforce, hey, please take your medicine, right? So for patient engagement, we always believe in 3 E's, whether you're practicing online or offline. So empowerment, encouragement, and enforcement.
Thank you. Thank you. There is a question. I'm going to take some more questions from the Q&A. So many questions. Let me check. Yes, I think this is on the top of many people. Every innovation and digitalization or anything new comes with risk. So many of our audience here, I've received a couple through WhatsApp and also through talking about data protection of patient records. How confident the patients can be in terms of data protection of the records and information in a digital world?
I suppose directed to me, right?
And Professor?
Maybe Prof. Wong, let's say first, a high level.
Well, I think your level and my level probably slightly different, but I think we essentially talk the same thing. I think that is a very important question about data protections. Now, I think a lot of time it's not the technology that actually is the problem. It's the user of the technology. I think that if I'm out to do something bad, I can do it with the same technology than if I want to do something good, right? So data protection, there's already a wealth of defined data protection things out in Malaysia, especially. So it's up to us whether do we want to follow. If we follow it stringently, there are technology to guide it. For example, I think a data up in a medical record, I think a blockchain is there. Like if we can use it properly, then that could actually help us to actually safeguard some of the data from being circulated, what I call unauthorized. So there are technology to do it. The question is whether do we want to do it or not. I think so. It's actually the person, the user of the technology, right? And then that actually brings to Dr. Choy, the user. How do you safeguard your user? Yeah, over to you.
Yeah, throw me right. Yeah. So quickly, for all the platform providers or industry player, right? So the health record and the patient's data are very sensitive and important. There is always a minimum requirement and on the standards, right? So it depends on which one you look at. So of course, the minimum would be PDPA, or for health record, you have HIPAA compliance, which is an ongoing process, right? And things like that. Ultimately, is really about the platform provider, how you safeguard the patient data and how you utilize it as well, right? And at the same time, is really the responsibility of the healthcare provider, the platform provider, as well as the patient themselves, right? You can have a very safe and secure e-banking system, right? But if let's say the user themselves are very careless about their tokens, about their credentials, right? There goes a breach of the data, right? So it's a responsibility of all parties. It's only not one, but including the policymaker. So right now, I think the players, everyone is actually minimum requirements of PDPA, and yeah. So it's a very tough, and we have to invest quite heavily into this cybersecurity. And having said that, hacker is always in front of the cybersecurity, right?
In in
any sector, what we are doing is actually to minimize and to mitigate the risk. And sometimes it can be quite reactive. When hacker comes, only we react. But some areas we can be quite proactive, right? But again, hackers are always in front of us, and we just need to be, go according to the industry standard. Yeah, I'm not sure that answer your question, but it's a tough question.
Yes, you do. I think we all can be, to a certain level, be assured that the data is protected, right? Like in any sector, we have to take the chance and make sure that the providers like yourself are taking action on that.
I think what Raymond had mentioned, Dr. Choy has mentioned also, it's important that we have to educate the provider how to handle the data, patients how to handle it, and then also the technologies who create the platform, how to actually create a safe environment. I think, and these are all, I think, things are emotions. I think, yeah, I think so. Yes, I think that is always an issue. I think it's same as banking. I don't see how this is different from banking, except that health is more important. Yeah. Okay.
Yes, correct. Plus, I think you mentioned a very, very pivotal word: education and creating awareness. That also goes to another question by one of our audience asking, how will digital healthcare manage all the fake consultants out there? A lot of people get influenced by all this social media diagnosis and advice. How digital healthcare will help solve that problem? Maybe your expertise and your advice to people out there who actually rely on some of the social media diagnosis or solutions that been shared.
It is difficult. I think it's very difficult because I think again it comes back to awareness. I think unfortunately in Malaysia, I think we tend to accept things as face value. And that's how social media are able to sway us and the anti-vaxxer, how to sway us against vaccination and so on. And so I think, again, coming back to what I've mentioned and you have highlighted it, education and awareness, that I think that the public should know, and then I think we should educate them how to assess the information critically. Right. And I once had that experience whereby somebody came in and said, right, exact what I call vaccine is terrible. Then I say, where do you get the data? So when he showed me the data, straight away I can say that this is from unverified source, uncredentialed, and all the data are wrong. I say whether that's the first thing they should know. Once they have seen that the source is unreliable, throw it away. The information is not worth reading. I think that's the one that I think that we should start educating our public how to access information they receive. Because now we are information overload, you know.
Yes, correct.
Yeah.
So
Yes, Dr. Sanjay,
so
what do you think? Dr. Sanjay, what is your experience?
No, I think that's very important. And for us, I think Dr. Wong and Dr. Choy, they are in different part of the system, and from where we come from, data privacy is very important. But at the same time, our job is to follow the science and ensure that we give the most credible data to the policymakers. So it's very important. And of course, pharma industry is regulated, so we can't reach directly to the patient. So we still have to reach and depend on the KEs and also the government when we are talking about the data point of view. So our role ends when we give it to the doctors. And I think from a patient point of view, we need to ensure that we give as credible information and as updated information to HCP so that they can give back the right information to the patients who are probably sometimes derailed with the invalid sources, right? So that's our role, and that ends there for us. We can't directly go to the patient as such. Yeah.
Thank you, Dr. Sanjeev. We have actually come to the end of our webinar, but I must ask this question for the benefit of our audience, especially those solution providers in our audience, those in the ecosystem who will be very interested. I mean, it's as like a concluding words from the three panelists. What do you think the growth areas in digital health in Malaysia are, and the opportunities for all the providers out there? Right. Starting with Dr. Wong.
Right. I think we should go the other way around. Dr. Sanjay first, I think.
Okay.
I think there's a huge opportunity. As I would say, we want to become a more of a platform type of a company. I think Malaysia is doing really good. We have seen the capacity when we see the vaccination is really, really good. It's just that we need more company to collaborate together to help the patient and be more patient-centric. So huge scope, I would say, and this is just the beginning. And we have capacity and strength and, let's say, intelligence in this country. We just need to come together and come to a solution and provide more information so the policy can be much more stronger for digital health.
Thank you.
Maybe me and Dr. Wong can do the closing. Yeah, I think I agree with Dr. Sanjeev that I think Malaysia now is really in the right timing. Of course, there's no right timing all the time, right? We are still in the infancy stage in terms of digital health. There's still a long way for us to go, but the opportunities are there because there's still a lot of pain points haven't been solved. When your healthcare system has got a lot of pain points haven't been solved, that's where the opportunities are. And it's for all the providers to see the pain points and how can you actually innovate and come up with a solution tackling the pain points. And that's where the opportunities are. So I remain very positive about digital healthcare solution in Malaysia because we're still in a very infancy stage, and of course it needs all the stakeholders in the ecosystem to really come together to move this industry together. It can't be me alone or AZ alone or Dr. Wong.
Absolutely.
It can't,
right? It has to come together.
Exactly, it has to be collaborative. Being the 4 Ps we always say, right? Policymaker, right, and provider, patient, and payer, right? So it is 4 Ps come together, right, and to move the industry. I think we stand a very good chance, to have a better healthcare services in the future. Yeah.
Thank you. And Professor?
I suppose, yeah, okay. Now, I think digital health is here to stay. I actually was telling my students just this morning when he was in my clinic, I said that what you see, what I'm doing now is just an exception because I actually have the liking for digital health, but for them, it's actually going to be part and parcel of it. Then they have to start learning about it. So I think that we actually have seen it. I think, and what I call the pandemic has accelerated that. And we expect that when we see the end of pandemic is where the digital health will take off in a big way. Because as we discussed earlier on, I think the mindset is important. If you don't accept things, you don't open the door, you can't go in. And I think the door has been half open. The people are now beginning to realize that, hey, digital health is possible, virtual consultation is possible. There are things that we can think about. So if they are willing to accept it, there is opportunity. So I think that is the first thing. So I think the mindset change is important. Then we are also in the place where we have a lot of good company, and the company are good. And then that if our mindset, the stakeholder, as what the Dr. Sanjeev has mentioned, willing to come together, I think that kind of coming together will create a huge momentum to push it forward. I think that's another thing. The third thing that we've seen actually is actually the vaccination program is one of the examples. But the good job done by doctors is something that we cannot underestimate, in the sense that I think they have now shown people that they actually are delivering it, and they are actually the next step. I would throw the challenge to him to actually come up with the analysis to show the benefit of their venture. So we have that ingredients, and then we already start doing bits and pieces of it. No doubt we are actually at the infancy, but the infancy is where the opportunity is.
Yes.
A baby that doesn't walk, when they start walking, they can start running and start actually sprinting, and then maybe fly at some stage, right? So there are a lot of opportunity here. So I think yes, I think it is for us to actually take hold of the opportunity.
So digital health is definitely here to stay. Great concluding remarks from our panelists today. On that note, thank you very much to all our panelists, Dr. Wong, Dr. Raymond, and Dr. Sanjeev. Really great having you. I think this is just a start of a discussion, and we will be happy to, from the chamber side, to facilitate further discussions and thinkings on this digital health. And Dr. Raymond, I do have some questions. Maybe I'll take it offline with you in terms, or separately email you on the vaccination part by our audience. Maybe you can advise us how to go about it. So with that, thank you everyone for tuning in to our webinar this afternoon. I hope you really enjoyed it and found it insightful. So before we leave, we just want to share our next upcoming interesting webinar on cryptocurrency, doom or boom. So with that, stay safe. Thank you again. Take care. Have a good week, the remaining of a week ahead. So thank you. See you all.
Thank you very much. See you.
Thank you.